to get myself off of mute. So welcome everybody. So I don't think we have anybody new here this time, but just reviewing the goals for the overall training for these 6 weeks. It's to help you mobilize new stakeholders, deepen relationships with existing stakeholders, and accelerate progress on current initiatives through, which is what we did last week, develop a short, compelling call to action based on your own leadership stories. This week and next week, we'll work on creating intentional strategies for community engagement, and then utilizing best practices and building strong, effective teams and coalitions. So here we are, week 3 already. Just a short little review on session 1. We learned about different leadership models, and the leadership model that we'll be using in this framework is called the Snowflake Model, or an interdependent leadership model. And then week 2, we talked about, it was developing the story of self, and you guys all practiced or started that and continue to, just continue to work on that. And then the next 2 weeks, you are working on building relationships and engaging networks. This week, we're going to be talking a little bit more about the strategy of it and kind of setting it up for the practice, which will be next week. So we're transitioning from thinking about our story of self into who you would actually share your story with to build your snowflake. So we're trying to build this snowflake where we can work with other people, and it's intentional recruitment of people. Because through its commitment with people, we build the power and we're able to affect change. So here we started with learning the importance of a personal story and how powerful that can be to motivating others. And then when we are intentional, we use that story to build relationships, which then builds teams to help us develop strategy together and take action and achieve our goals. So it's all based on relationships. We also learned that leadership, and I'm doing just a little review, is taking responsibility for enabling others to achieve shared purpose in the face of uncertainty. And just remember, the leaders don't do all the work themselves. You don't do it alone, you work with others. And the first step is to lift others up so that you can take collective action together. So in this session, we're going to learn about how you focus on enabling others to join you in what you want to work on and initiatives that you want to work on and efforts to achieve. So why do we build relationships? Lots of reasons, right? So in the context of getting things done, relationships help us expand our capacity because we can't do it alone, and to build our power or the ability to actually get things done. So you probably remember this leadership diagram that we talked about in week 1. And I think we've probably all been there, where we are the dot in the middle, right? And we talked about how that feels and some of the risks related to it. I mean, it's the risks of being burned out. You're doing everything alone. You're not building capacity in others. And then what happens if you leave your job or your role? Basically, the efforts fall apart. So the leadership model that we are working on and is the basis of this framework is this one. This is the Snowflake Model. So it's interdependent leadership. So we think about, what is relationship anyway? It's a commitment that is based on a shared past and a shared future. And just remember that the core unit here of activity is the team. And the team comes together because they have shared values and they have shared purpose. And the way everything is held together, it's based on commitments that they've made to one another based on relationship. So we think about commitment to cause. You can be committed to a cause versus committed to a relationship. They both bring commitment, but the commitment to a relationship is what really keeps us doing our work together, because it's the people that we serve. And I know I just identify so much with this, because to me, relationships are like the most important thing and the thing that I treasure so much. And so I really resonate with basically everything in this model. So relationship enables you to build capacity. And first, it's by distributing the work and development of a leadership team, which happens through one-to-one meetings. Barb's going to teach us about that next week. And then by building a community that shares your values and is willing to act collectively to help you achieve your shared purpose. And that's how you create the power you need to make change. So we think about amassing our resources to make the change that you need. It's very intentional. So we're not just like haphazardly building this snowflake, but it's very intentional. And when we think about the people that we would invite, or you think about the people that you'll want to invite to help you achieve your initiative, think about what your goal is. So in week one, we had you just like brainstorm, what is it you would like to invite other people to help you with? So keep that in the back of your mind as we move forward to day 2. We called it your call to action. So this picture shows the development of commitments between like 2 individuals. You know, we each have interests, we have our own resources. And when you identify somebody as a potential partner to work on your work, your initiative, you would invite them to come together for a meeting, where we call them ones. And that's where you share your story with each other. You talk about what you care about, what you do, what they're doing. And as that relationship grows, so does the commitment. And it's during these relationships that you bring resources and an interest. And I mean, I know that I act based on the relationships I have with others, and that's in addition to our shared values. So it's not just your shared values, but it's that relationship and the commitment you bring together. So how do we actually build relationships? The key tactic for relationship building in this framework is the one-to-one meeting. And so this slide lists the 5 steps, but we're really just going to be talking about step 1 today. But it's very intentional and it's very specific. And so the first step is selecting an attention. So how do you select who you want to work with? And who would you want to have a one-to-one meeting with? And then you end up doing all 5 steps until you end up with a commitment. So the selection and attention, that's what we're talking about today. So you're thinking about the one-to-one meetings are something that we do regularly. You know, and of course, now that we're in the virtual world, it's one-to-one meetings over Zoom, or, you know, over a virtual works better. You can do it over the phone, but really, I think that face-to-face is the best. And it's the important key for this relationship building. So first of all, keep in mind what your project is or your initiative and what your goals are when you're thinking about who you'd want to ask. So you think to yourself, who do I know that can help me with this? Or who really cares about this topic? Or like who would actually do the work? I think a lot of times it's easy for us to think about kind of the organizational chart and the hierarchical leadership and maybe go right to the top, the person at the top, the CEO or the leader of the organization. Excuse me. But just remember that all organizations have many different leaders. They may be formal, but then there's also many informal leaders. So you want folks that can actually help you do the work as well. So typically you probably start with people you know, people in your network or organizations or people in your network. These are the ones you have strong ties to, and you know them, they know you. There's already, you know, some kind of a relationship or at least an acquaintance there. But you want to also look for the people that don't share your network, because this helps you build your snowflake and expand your access to other people. So usually you start out with like the usual suspects, the people we know, and that's okay for a while. But I really want to encourage you to think about how can you expand your network to include people in organizations you don't know. And in organizing, we call this the strength of the weak ties. So So I'm talking about people or organizations that might be in different geographic areas from you. They may be different generationally than you, so a different age group. They might be culturally different. They may even have a different focus on their work, but there may be something that would be common for you to be together. And so we build these intentional relationships with people that we can share our goals and passion outside of your current network. And that multiplies our resources because those folks may know other folks, so your snowflake can expand and grow. So when we think about who do we pick, or what are the characteristics we look for in people and organizations that we want to join us, these are some of the things that come to mind. And I won't read all of these, but they're pretty obvious why you'd want them. You want somebody open-minded who can think of other, be open to other ideas. And really, that includes ourselves. So especially as you're bringing in people that aren't in your network or they may be unknown to you, be open-minded for their suggestions. People that are dependable and that you can rely on, somebody who's a good strategic thinker. And there could be other characteristics that you'd look for as well. So like I said, this is very intentional. So what we do in this program, it's called mapping the actors in your environment. So this diagram shows the different actors that are that would be in your initiative. So they kind of divided into two buckets: the shared values, those that shared your values, so the constituency, support, and competition, and those that have opposing values, so your opposition. So we'll talk about constituency mostly in leadership today. This is the most important bucket. These are the folks that you're going to work alongside. They're going to work alongside you. They're going to actually get the work done. The leadership is a subgroup in the constituency. So they're on your team. These are your people. And you're going to get them by doing the one-to-one, which Barb will be talking about next week. Then the support group, these are individuals or organizations that, they share your values, but they're just not in the weeds with you doing day-to-day. They may be at a higher level, like say a trade organization as a whole. And I'll give you an example of the initiative I worked on when I mapped my actors. Competition, they share your values, like they agree with what your purpose is, but they may want to do it their own way. The competition here is they may be competing with you for individuals and resources. And then the opposition, where they do not agree with your values. The thing to think about here is really not to focus on these organizations or individuals, but maybe to understand a little bit about, why they feel that way. What would they lose if you were successful? What's going on in their organization that they would maybe be opposed? So we're going to hone in more on the constituency, which would be your people. These are the constituents. These are the ones walking side by side with you as you want to make your change. So think about who they are, what their interests are, and what some of their resources might be. And note that the opposition, competition, and supporters, they may all come from the same organization. So you may have individuals in an organization who are on your constituency or your support, but there may be some in that organization who actually oppose you. So you just want to be aware of that. So when we think about resources for the kind of work we're doing, where we're trying to make a change in people's lives, we think of them in two kind of buckets. One is acquired resources, and that would be like finances, maybe certain skill sets, knowledge, that type of thing. But natural resources, you also want to continue. So that'd be like people have time, they may have passion, they may have the energy to help you in that work. So as you're thinking about who you may want to ask to join you in your initiative, think about what resources they have and what they can bring to your organism. And this, I will say, this was kind of a new thought for me, to really identify resources that somebody or an organization might have. And so I'll share my examples of what exactly they mean. So I have two examples, and this one you can read easy because it's typed. And so I'm just going to have you look at this later because I want to go into more detail about my home health example. So when I was, I mentioned in the first week when I did the first session that as I was taking this leadership and organizing and action training for the second time, I was just starting in Minnesota on this initiative where we had identified, we had a problem in our state where when people were referred to home health, like when they were discharged from the hospital to home health, we had a huge proportion that were not accepting services compared to the national. And then those people that didn't get home health that should have had a much higher readmission rate, and we were trying to reduce readmissions. So I wanted to develop this group. We called it the Home Health Gap Collaborative. And so I identified my constituency, supporters, opposition, and competition. And actually, there is a leadership group in here that I don't have on the map. So when I first thought about this, it's like, well, who cares about this? And so, obvious, well, hospitals care, right? Hospitals and health systems, because they get penalized if there are too many readmissions. And so I listed some specific hospitals and specific people. So when you map your actors, even include specific people or maybe a role. So for example, hospitals and health systems, what they had as far as resources, it was best practice. They had influence. You think of the influence that hospitals and health systems have in the healthcare environment. They had their own internal data. I also included home health agencies with specific home health agencies and people. What do they want? They want increased home health uptake, right? They want more people in home health. They want reduced readmissions too. And what kind of things do they bring? They brought best practices, home health best practices, and time, staff time. I put the QIO, that was me, on there. So I really wanted to improve on readmissions. I wanted to decrease admission rate. And what did we bring? We had staff. So we had time. We had data that none of these organizations had. So we could bring data. We had relationships across the whole continuum. We also had facilitation expertise that we could use. Then I looked at trade organizations. I looked at our Minnesota Hospital Association. So they represent all the hospitals in the state. They also had staff time, facilitation skills, influence. The home care agency trade organization, they had a clinical quality team that we wanted to reach out to. What did they have? They had best practices. They had leaders in the field. And then just building that. So my leadership team ended up being the QIO, the Minnesota Hospital Association, and the Minnesota Home Care Association, leaders in those organizations. So we ended up with a leadership team. But then all our Snowflake included skilled nursing facilities. So they had best practices from the skilled nursing side. We also included assisted living facilities, area agency on aging. Their resource that we wanted was they could reach out to consumers. We had a patient and family person, and their resource that we really wanted was they had the actual experience of a patient or family. And that was invaluable to have that input. We changed our approach because of things they said. We also had payers on the team, health plans, et cetera. Then looking at supporters, what I put down for supporters were our trade organizations. So long-term care, the hospital, and home care trade organizations. They really weren't in the weeds with us, but what they could do was support the initiative. And then when we develop best practices, we would have a venue for sharing our lessons and best practices. For opposition, I didn't really have an organization. I couldn't think of who would oppose this, but I put things down like competing priorities of organizations and time that was opposing the work. Also financial resources and constraints. And then for competition, and this, I just kind of made this up or thought who might be in competition, but I put privately owned home health agencies because I know sometimes the privately owned and the hospital-based, there's kind of a competition between them. And I also put health system ACO because sometimes, in experience, they hadn't been quite as willing to share their best practices, or they wanted to do things totally their own way. It was potential competition. So that was my map of actors, and we actually recruited individual organizations that were on our list. And I think using the sticky notes is a really fun way of working, if you're working with somebody else or a small group, to identify who else could be your map of actors. So now we're going to do our small group exercise, which is mapping your own actors. So if you have your participant guide that was sent to you earlier, we're going to be working on pages 9 through 12. So 9 kind of talks about, gives the instructions, and then there's a picture of the resources, and then you'll actually be writing, just like drafting your constituency on page 11. You're going to be brainstorming. So first of all, think about that ask that you maybe developed the week 1, or something that you want to invite other people to help you with on an initiative. That's what you need to think about, like, who would I want to invite? So as your kind of foundation. Then we'll focus most of our time on constituency. So these are the people that are like-minded and that you'd be working along with. If you have time, go ahead and fill out opposition or supporting as well. You get about 10 minutes to do that. Then we'll have you share your map with your small group. Just kind of describe who's in it, or hold it up on the video. And then if you still have a little bit of time, on page 12 in your handout is a table that lists people that you would potentially want to do one-to-one visits with once we learn how to do those. So you've got your list started. Maybe put 2 or 3 names down. So it's somebody that we want you to practice with in the next month after Barb's session next week. So hopefully I explained that well, and then we'll go into our 4 groups. Jess will put us in our groups. So Nancy will host one, I will, Barb, and then Jess as well. And then we'll come back and report out. And we're going to actually draw out somebody's map of actors.